All of these are production machines, and subsequently the rollout of the machines to Yemeni healthcare facilities and across communities. So whilst we celebrate the success of the mechatronic engineers today, the process was certainly not without challenges, having to work virtually and with engineers in a country that has limited connectivity, electricity, and bandwidth. So what have we achieved so far? Just a few points I would like to share with you. First of all, 10 micro enterprises are now producing PPE for sale using the designs developed by the mechatronic engineers. The ventilator has been showcased to the Ministry of Health and recommended for registration with the Ministry of Industry and Trade. UNDP's Emergency Health Response and Recovery Project has purchased the automatic mask machine and has placed an order for a second one. UNDP's Emergency Health Response and Recovery Project is also working with trained MSMEs to purchase 25,000 non-medical masks, 15,000 fabric masks, and 50,000 face shields. And finally, orientation has also been conducted for Indian NGOs to transfer skills and knowledge held, and knowledge transfers on ongoing support them in producing their own automatic mask machine. It's really a nice example of South-South cooperation. So what is it that we would like to say? What message do we like to convey today? Well, a couple of points here that I will share with you. First of all, UNDP and the University of Wisconsin and the Engineers Without Borders have demonstrated the potential of virtual collaboration amongst global actors, so true innovation, and thereby responding to local needs with global expertise. Innovation and collaboration are obviously key to capitalize on the collective knowledge and experience of both these local and international actors, such as through this project. Yemen thus has the local capacity to respond to critical problems, but it was clear they need capacity support and financial aid. And we found that this model can be replicated in other contexts in other sectors outside of the health sector in Yemen as well. And the final point, which is a key lesson learned, of course, is local solutions are absolutely sustainable, but they're certainly not without challenges. Now, going forward, just going through the agenda quickly, after I finish the welcoming remarks and the housekeeping issues, we will go to the panelists. First of all, Luca Rende will give a brief background, and then we'll go through the panel discussion, and I'll introduce the panelists in a second. Then we'll go through a Q&A session, and then we'll give Hashim, the Yemeni engineer, a chance to go through some reflections and closing remarks, and then I will close the session at the last 10 minutes of our webinar. So let me just start with introducing the panelists. First of all, I'd like to introduce my colleague and friend, Luca Renda. I know him for a very long time. At the moment, he is the head of the Recovery Solutions and Human Mobility at the Crisis Bureau of UNDP in New York. He has over 20 years of experience in a variety of development settings with increasing responsibility, starting as a UN volunteer in Liberia back in 1997. Then later on in UNDP, Luca served as the program manager in the Emergency Response Division. And this is where I learned to know Luca from 1999 to 2000, and then the Regional Bureau for Latin America and the Caribbean from 2000 to 2004. He was the deputy resident representative in Ecuador from 2004 to 2007, and Honduras 2007 to 2012. And finally, he was the country director of UNDP in Lebanon from 2012 to 2017, where he worked also on the UN response to the Syria crisis. Between 2017 and 2020, he undertook special assignments, such as the head of the UN Crisis Management Unit in Dominica, coordinating UN and UNDP post-disaster recovery efforts, and resident representative in Guyana, and special advisor for the UN transition in Haiti. He graduated in political science and international relations at Louis, and holds also a Master of Science in Development Studies from the London School of Economics. The second panelist is Arvind Kumar. He's a project manager with UNDP Yemen. He's obviously a colleague of mine. Arvind has worked for more than 17 years in the area of development, and humanitarian issues, disaster risk reduction and resilience, and led various assignments in conflict, fragile and natural disasters environments in the range of capacities. He has also worked in Asia, Middle East and Africa regions, and Arvind has managed a number of large-scale emergency and humanitarian response projects in Yemen, Sri Lanka and Sierra Leone. So with UNDP, in Yemen, Arvind manages stabilization, resilience and economic recovery projects and provides technical and operational support to project counterparts in Yemen. And Arvind, he holds master degrees from the Barkatullah University, Madhya Pradesh, and the Asian Institute of Technology in Thailand. Then it's my pleasure to introduce Jess Thayer. She's a controls software engineer with Mechatronics Engineers Without Borders in the US. She is a mechanical engineer and is a long-time Engineers Without Borders USA volunteer, working to incorporate biomedical engineering into the EWB's healthcare facility projects and disaster response efforts. Since the widespread effects of the COVID-19 pandemic began in March, Jess and the team have launched local PPE production and medical equipment repair efforts in several countries. And she's currently based in Connecticut as a surgical robotics controls engineer for Medtronic. Then a special welcome to Hashim Annam, a mechatronics engineer in Yemen. He graduated from Sana'a University in 2018, and he works as a freelancer in programming Android applications. He also works as a volunteer with the Gaith Youth Initiative. He got trained in industrial automation and participated in national contests for creative youth with his project 5-axis CNC machine. And Hashim is interested particularly in artificial intelligence and machine learning. Then I'll go to the introduction of Rebecca Alcock. She's an operations research and global health student at the University of Wisconsin, looking at engineering, studying industrial and systems engineering in the Analytics for Human Development Lab. Most recently, she served as the International COVID-19 Engagement Coordinator for the UW-Madison International Project Office. UW is University of Wisconsin, right? In this role, Rebecca coordinated the partnership between UW-Madison, UNDP, the Engineers Without Borders, and other partners on capacity building and livelihood initiatives in the face of COVID-19 for communities in low and middle income countries. And her mission is to combine her current training in optimization and machine learning with her background in product design to address pressing global health and planetary health challenges. She has ongoing projects in the areas of health clinic electrification, emergency food assistance, and disease prediction. So this was the introduction of the panelists. We have a very esteemed group of panelists today. So again, a very special welcome to them. And we're looking forward to a very fruitful and interesting discussion. Let me just finish up with repeating the rules of the game so that everybody is clear. Again, the questions and answers should be submitted through the Q&A box and will be answered during the Q&A session. So after the panelists have spoken. Any technical issues that you still may be facing, please raise them in the chat box so that someone from our team can help you to resolve them. And then finally, we hope that everybody is now settled with regard to translation, be it in English or in Arabic. If you have any issues, please also refer to the chat box for any assistance. Then finally, I don't want to acknowledge and express my gratitude to not only UNDP, but the European Union and Swedish SIDA for the financial support. And also, of course, to our partners, the Engineers Without Borders, the University of Wisconsin-Madison, and the UNDP Crisis Bureau for all their support to make this happen. So thank you very much. With these words, I would like to turn the floor now to our first panelist slash guest, which is Luca Renda. So Luca, over to you, and we're looking forward to your first introduction and a very interesting discussion. Over.
Thank you, Auke. Thank you for this nice introduction. Indeed, we have known each other for some time, back starting our careers at the Emergency Response Division of UNDP, and then continuing to serve in many different locations It's really a pleasure for me to be here, and thank you for inviting me to just give a few brief introductory remarks, just to explain the origin of this project and how it came into existence. And so very happy to see now the results of this in Yemen. I think this is a rather unique project, and you said it, Auke, at the beginning. It's really an example of how, amidst the loss and the pain that the pandemic has inflicted to us, it's also a reminder that the pandemic and has also forced us to work in a different way. So it has been an opportunity to innovate, to find different ways to connect, to transfer knowledge, and to overcome many barriers, not just physical barrier. We're also, as you said, you overcame technical barriers, language barriers, and be able to connect expertise to support a group of young, motivated, extremely talented engineers in Yemen, and help them realize their dreams. This all started with the fact that UNDP and the Engineers Without Borders have a relationship that goes back to the time where we worked together to respond to some of the disasters that happened, particularly in the Caribbean and Mozambique. So we knew, of course, the strength of the Engineering Without Borders when it came to structural engineering, supporting reconstruction efforts. But what we learned is that they also have a network of medical and biomedical engineers. And this is, we learned that they were doing something very interesting in Guatemala, where they actually, through connecting their local office in Guatemala with the expertise of the University of Wisconsin, they had actually supported a process of going from assessing the needs to actually prototyping, manufacturing, and distributing PPE and other medical equipment to fight the pandemic, using local capacity, local resources, etc. And they come out with a series of lessons learned. And then the question was, okay, Engineering Without Borders has an office in Guatemala, but it doesn't have office in other parts of the world. Can we use UNDP infrastructure, UNDP technology, UNDP expertise to replicate this experience in other countries? And this is actually exactly what we did. We signed an agreement with the University of Wisconsin. They put at our disposal this extremely talented team of biomedical engineers, and we started looking at ways to replicate this experience in other countries. And we found, of course, in Yemen, a very enthusiastic and very response, and the fact that you were already working on innovation and on other ideas that were fitting, they say, the offer of this project, and so we started to partner, and the team of the Engineers Without Borders and UW had put together what they call a handbook or a playbook. How do you go from assessing the needs, even through digital surveys, and to go to all the way to prototyping, and then manufacturing, then distributing. It's a process that you say very well. It's not easy, and it has many challenges, and all the more in a context like Yemen. But the combined efforts of different teams within UNDP, because we also partner with the health team of UNDP, and the offer and the technical expertise of the EWB and University of Wisconsin, combined with the commitment, enthusiasm, and talent of the Yemeni engineers and the full support of the Yemen country office. This is how we came to realize this project. And I want to end my my intervention by thanking all the people involved, the EWB, particularly Mike Paddock, who was the first person that contacted me and told me about the experience in Guatemala. Rebecca, Jess, and Dana, and all the teams of UW, Elise Ann, who is our main counterpart at the University of Wisconsin, the person that when we negotiated the agreement. The team at the health team of UNDP, Cecilia and Judith, My own team, and particularly Yuko Hirose, who has been a driving force behind this initiative, the whole staff of the Yemen Country Office, you, Auke, Arvin, and all the other colleagues involved. And of course, a big tribute goes to the young team of Yemeni engineers. So much talent, so much initiative, so much enthusiasm. We're so happy to have helped you. I want to stress one last part. All the involvement of the University of Wisconsin and the team of engineers, biomedical engineer, has been on a volunteer basis. They have not received any special monetary compensation for this. We just reimbursed the university for some of the operational expenses. And this is a model that can be replicated in other country offices. So if there's any colleague from other country offices connected today who want to replicate this experience, we're happy to do so. Thank you very much. I wish you a fruitful discussion. Over to you, back. Okay.
Thank you very much, Luca, for these words. I want to immediately go to the panelists, and starting with Hisham, asking him a couple of questions that he can then respond to and talk about his experience. So Hisham, what prompted you and your colleagues to start working on these machines? And then also perhaps if you can talk a little bit more about what challenges you were facing during the process. Over.
Thank you so much for that question. Before I answer, I would like to give you a brief introduction about Yemenis mechatronics engineers. First of all, hello everyone. My name is Hashim, a member of 12 Yemenis mechatronics engineer. This team was brought together by undergraduate studies over the course of 5 years. Despite the crises that occurred in Yemen from the beginning of the events until now, this did not prevent us from working together. After the pandemic swept all over the world, we found it obvious that it will definitely reach Yemen. So, weak health sector in country torn apart by civil and foreign wars, the consequences will be horrible. So we moved and paid all our attention to the health aspect, especially the fight against COVID-19. Well, a worn-out health sector, the difficulties of importing, and the almost complete lack of medical materials, these are the main reasons why we started. The beginning was with the smart disinfection tunnel, which was initially approved by the WHO, and not for a long time, as it was proven this innovation has side effects. Then we moved to the manufacture of PPE kit, which we expected to be monopolized in the market, and its prices increased. So we tried to make it simple and inexpensive so that is accessible to all people and it's not bounded to a certain class. Critical cases that need a ventilator, and there was no possibility to provide them due to the few devices available in the health sector. There was a need to invent a ventilator that is manufactured in the simplest ways and in the least possible time in the event that is entered into a production line. So let me now, please, I will move to Muhammad Muhajib, who is specialist in mask machine.
Is Muhammad there on the line? Muhammad, are you there? Hashim, we don't hear from Muhammad, so perhaps you can just continue, and then we'll give Muhammad a chance to come in when he's online.
Okay, so what about the message?
تسمعني؟
Sorry.
الو اي بسمعك.
Yeah, we can hear you now. Go ahead.
هل تسمعني؟ شكرا هاشم، شكرا للجميع على هذه المقدمة. في الحقيقة بدأت جائحة كورونا ورأينا انهيار العالم بأكمله أمام هذه الجائحة الخطيرة. شعرنا باقتراب الخطر في اليمن، كثرت عدد الإصابات، ازدادت أعداد الوفيات. قررنا العمل منطلق من واجبنا في هذا المجتمع على إنشاء آلة لصنع كمامات في ظل التحديات، في ظل شحة الإمكانيات ووسائل التصنيع التي تكاد شبه معدومة. في خلال ظرف بسيط معين استطعنا من مكان بسيط جدا تحويله إلى ورشة عمل متكاملة. تم إنتاج آلة كمامة متكاملة شبه أوتوماتيكية قادرة على إنتاج أزيد من 80,000 كمامة في اليوم الواحد. استطعنا توفيرها الأسواق المحلية متاحة للجميع. كانت من الصعاب اللي واجهتنا في عملنا عدم توفر الإمكانيات، وسائل والمعدات البسيطة ووسائل التصنيع التي تكاد شبه معدومة، لكن بفضل الدعم الفني والتقني من مهندسين بلا حدود وأصدقائنا في جامعة ونسكون استطعنا التغلب على هذه المشاكل. انتقل إلى هاشم.
Thank you, Mohammed. Hashim, back to you.
So now we'll move to the question of what challenges that faced us. So actually, we faced many challenges and problems, but as engineers, we had to find the right solutions at the right time. Challenges such as bad internet access was the biggest problem we faced if we needed help from EWB, or if we were looking for information on the health side. Also, going out to the local market to search for parts or materials at the height of the pandemic was a great challenge, as we were trying with all our energy to follow the prevention procedure while working at home and abroad. We were trying to set an example in the community by following the safety procedure. Most of the team got sick due to COVID-19, then they recovered, and it was a challenge in covering the team's numerical shortage. I can now move to Muhajib to cover some points here.
Please unmute.
واجهنا العديد من الصعوبات والتحديات، كانت أهمها عدم توفر آلات التصنيع الأوتوماتيكية CNC ماشين. استطعنا خلال معدات بسيطة جدا عادية أن نصنع هذه الآلة. في اليمن شحة الإمكانيات، شحة الموارد، كمان المواد الخام لا تتوفر، فاستطعنا من خلال مساعدة أصدقائنا والدعم التقني الذي قدموه لنا التغلب على هذه المشاكل. انتقل إلى هاشم.
So I think here we covered the first question, so we can move.
Yeah, thanks a lot, Hashim, for that. Immediately we will go to the second panelist, which is Arvind Kumar. Arvind, good afternoon, good morning to you again. Two questions for you as well, so if you could please cover that. So first question would be, if you could talk a little bit about how did you first come to know about Hashim and his group of friends of mechatronic engineers, and then given the pandemic, this is the second part, and the limitations for collaboration that came with it, how did you conceive this collaboration and how did you think it would contribute to its success? Over.
Thank you very much, okay, and greetings to all of you colleagues. Very heartening to see this event taking place. So we were in the middle of developing this rapid response facility initiative, which was started by UNDP globally. And in that particular time, UNDP was in a unique position where we could see the impact of health in the sector due to pandemic. On the other side, the socioeconomic aspects of the pandemic. And therefore, while during the development of the concept note and the proposal, we were thinking that how do we bring the innovation, PPE, and income generation aspect, because that can definitely, PPE can support health response, but also income generation can support the socioeconomic response. And then we were struggling that, what we needed to do is now we can understand, but how we can do and who will do that. And then I had a discussion with my colleague who is a solar energy expert. He said that there are a group of engineers who are very good in robotics and artificial intelligence. Maybe they can be helpful because we wanted to develop the tools using local resources, as Hashim was talking about. And then we discussed within our senior management, and Nahid said, okay, please go ahead. And that's how we came across the group of engineers who seem to be very motivated in this particular initiative, knowing that they also represent the youth community for Yemen. On the second aspects, we were now in the first part, we found that who will do that? It was these group of engineers, but then we wanted to know how it will be done. Obviously, that was the biggest challenge, and knowing that import issues, the challenges of bringing PPE kit. So I think the push was to go for a local production for PPE. That's where UNDP was also supporting through the socioeconomic framework to create more of income generation and support communities for affordability. And then we connected to Crisis Bureau, and that's where we found that there is already a consortium with Yuko and Luca, guidance from Luca. We managed to bring these three strings together. Basically, it was a community, it was also an institution and science coming together to kind of help Yemen in responding COVID-19.
Great, thanks a lot, Arvind. Then we will move on to the next panelist, Rebecca Alcork. We know Yemen is widely known as the worst humanitarian and development crisis in the world, so it's a very interesting background. So what was the University of Wisconsin's role in the collaboration would be my question, but also to maybe reflect a little bit on whether you have seen this work in other contexts, and how was Yemen different and perhaps also more complicated than in the rest of the world. Over to you.
Yeah, thank you. I just want to start by saying it's an honor to be here and participate in this panel. And thank you for those questions. To start with UW's role, or the University of Wisconsin's role, I really think we actually ended up having three primary roles. So the first of these was really to be a coordinator. And along with Yuko Hiroshi from the UNDP Recovery Solutions and Human Mobility team, we coordinated the efforts of the three partners, UNDP, Engineers Without Borders, and the University of Wisconsin. So this included leading our video calls when appropriate, developing action plans, as well as convening a working group for this initiative on the University of Wisconsin's end. So that actually leads me to our second role, which was to serve as a source of expertise. So universities in general have a vast breadth of expertise. For example, here at UW, we have the faculty expertise to offer over 250 undergraduate majors and certificates. But also these faculty members are working to the current limits of knowledge in their fields. So partnering with a higher education institution allows for quick access to this wide-ranging yet deep knowledge. And given the unprecedented nature of the pandemic, we didn't know at the time what exactly the needs would be. So this working group structure was really crucial to responding under uncertainty. And UW's working group was led by Professor Paul Block from Civil and Environmental Engineering, as well as Dr. Yanis Toupesis from the School of Medicine and Public Health, Department of Emergency Medicine, and our Global Health Institute, as well as Elise Ahn and me from the International Division. And then our group beyond that consisted of 14 faculty members across 7 schools and colleges and 15 departments, including engineering, medicine, education, communications, and business fields. And so these working group members were kind of on call to respond to any requests for expertise throughout the partnership. And finally, that brings me to our third role, which was to develop tools that supported the work we were doing. So throughout our partnership with UNDP and Engineers Without Borders, we created a workbook for local PPE production that could be picked up. The goal was that it could be picked up by any UNDP country office or any NGO or other entity interested in developing a product locally. And it would walk them through the entire process of doing just that, just like Luca mentioned in his opening statement. So starting with identifying the key stakeholders and conducting a rapid needs assessment all the way to production. And since this workbook was being developed in parallel with the efforts of the Yemeni engineers, they didn't utilize it directly, but we did help guide them through the workbook's framework. And even more importantly, their experiences, strategies, and expertise were baked into the workbook. So that expertise that they provided us went on to improve how we provided support in future engagements. So in summary, I guess the three roles for the University of Wisconsin to be a coordinator to supply wide-ranging and deep expertise, and then lastly, lead the development of the supplementary tools for local production. And then I think the second question, we can jump right into that as well, was have we seen this work in other contexts? So yes, we did see this work in quite a few other contexts over the past year and a half. And it actually started in our own backyard. So here at the University of Wisconsin, we were also facing PPE shortages starting around March of 2020. And so similarly to actually how the work started in Yemen with the group of engineers in the hackathon, here at the University of Wisconsin, our makerspace was really responsible for developing PPE in those early days and then spreading it to the private sector here. We also saw this work in Central America, particularly Guatemala, as well as the African continent, so Malawi and Sudan, and then as well as Central and South Asia, so the Kyrgyz Republic, the Republic of Maldives. And every context kind of had its nuances and included different stakeholders. So for example, in Guatemala, the local PPE production initiative was largely driven by Engineers Without Borders Guatemala office and a local Rotary Club, and unfolded in close partnership with the Ministry of Health and 12 hospitals. In Sudan and Malawi, on the other hand, the work centered on higher education institutions. And in Maldives, it was a very tourism-focused effort. In Yemen, however, really the engineering team and the private sector really drove the response. So it's an interesting case study of how the private sector can play a huge role in crisis response, particularly taking on more risk, be more innovative and more entrepreneurial in their solutions than other entities might be able to be. So I just want to also end by saying that the Yemeni engineers, the team's enthusiasm and their ingenuity was unmatched. So it's been an absolute pleasure for me and the University of Wisconsin to play a part in realizing their visions. So thank you. Over.
Thank you very much, Rebecca, and thanks very much for all the help that you have provided to Yemen and the Yemen engineers. I mean, it's really great. We go to Jess now. Jess, just two quick questions to you. First of all, could you explain a little bit more what was the role of the Engineers Without Borders in this collaboration? And then if you could also look at and reflect on what kind of creative solutions did you have to adopt eventually to make it work in the Yemeni context. Over to you, Jess.
Yeah, thank you. First of all, just thank you for having us. It really is an honor to be a part of this team. And we're excited to share a little bit of what Engineers Without Borders looked like throughout this. But in terms of our role, Engineers Without Borders' role was unique in that it really was a connecting piece between the deep technical expertise that the University of Wisconsin team brought with the reality of the situation that the Yemeni engineers were facing. And then we provided technical guidance on developing low-cost, easily manufacturable personal protective equipment or PPE. The Engineers Without Borders team brings practical disaster response experience working in low and middle income country contexts. And in particular, we had a lot of lessons learned from an earlier COVID response program in Guatemala that Luca and Rebecca mentioned, which was focused on local production of PPE items, really in partnership with healthcare facilities and the Ministry of Health. So in March of 2020, when COVID was beginning to reach the United States, our Engineers Without Borders team launched this, this response program in partnership with our country office in Guatemala there. And I know this has been talked about, but we knew that this onslaught of the healthcare system was coming from COVID. We were seeing it in other countries, but throughout that previous work, the important piece was that we had developed really meaningful partnerships with frontline healthcare providers. So while we were prototyping PPE items, we had 12 partner hospitals that were providing feedback throughout the entire design process and iteration process. So by the time we came to the Yemen context, we had developed this technical guidance, and it had been vetted by multiple different healthcare providers and facilities in not quite as extreme of the context of Yemen, but also in other low and middle income countries. That's also how we got connected to subject matter experts at the University of Wisconsin and other universities and US hospitals. And we'd also gained a lot of experience with the emergency regulatory systems that we saw enacted during the crisis. So our team worked very closely with the University of Wisconsin, and we just played a supporting role in providing expertise, helping the talented Yemeni engineers narrow their focus on products that would have the greatest impact, and then sharing those PPE product specifications that could be locally sourced and were easily manufacturable, answering questions and providing review of their designs. And then everything about a crisis response during a global pandemic requires you to be really creative in your problem solving. But we had a really great team that was able to adapt and step up to the challenge. We had all of our meetings virtually, and we mentioned already the challenges in connectivity in Yemen. So we also used Teams to keep open lines of communication around the clock. So it's very frequently for us to be reviewing something during work hours in our time in the States, and then get answers in the middle of the night or really early in the morning from the Yemen team. And although it was like certainly a challenge to convey design properties virtually and across language barriers, the Yemeni team was able to share drawings and material specifications of their design for the Engineers Without Borders and UW teams to review. We in turn shared those technical guidance documents all through Teams and all online, and gave them considerations that the engineers would need to make in each of their products. Because local healthcare facilities weren't available for partnerships in Yemen to evaluate prototypes, we leveraged feedback from healthcare providers in other countries to inform the team's design decisions. And because the team didn't have access to regulatory testing, we adopted some low fidelity tests, such as spraying liquid through the masks, as a comparative test to assess the product's effectiveness and readiness for formal testing. Our efforts in Yemen were particularly challenging because we didn't have engagement from any entities outside of our team in other similar COVID response programs. As Rebecca and I have mentioned, we had working relationships with the Ministry of Health and/or partnerships with local hospitals and regulatory bodies. Without that luxury, we had to rely heavily on the experience from outside of Yemen that the University of Wisconsin and Engineers Without Borders brought to support the Yemeni engineers as they blaze in their own path to success. That being said, our success really came from the unique partnership between all three of the teams. The university provided that deep technical expertise, but academic institutions can also be sometimes limited in their risk-taking and speed because they're designed for that deep technical expertise. So Engineers Without Borders was able to bridge that gap with crisis response experience, where we always remember to compare our decisions with the do nothing option, which provides the team the perspective that we need to move quickly and be flexible when solutions aren't ideal. And ultimately, despite all the barriers that the team faced, it really was the energy and persistence that the Yemeni team of engineers showed that capitalized on the support that the University of Wisconsin and Engineers Without Borders provided. And that's really what made it us successful. Over.
Thanks, Jess. Great story. And you give me a nice segue also to go to the next panelist for some more questions. Just to say, due to the ongoing conflict in Yemen, the health system has virtually collapsed. More than half of the health facilities are currently not working, which is one of the great difficulties also in the COVID response. Now, Hisham, also the fact that Yemen is so isolated from the rest of the world due to the blockade and the fact, it's very difficult to travel in and out of Yemen, makes things rather complicated, right? So my question to you, Hisham, is how did this collaboration actually change things for you? And what is next in store? What are you going to do next after this successful project that just was completed? Over to you, Hisham.
Thank you. So collaboration with the Engineers Without Border was one of the best ideas that the UNDP came with, as it provided us with important information with specialists in the technical side. EWB was close to us and in contact in case we needed anything. Sometimes we were missing some pieces. We would suggest alternative solutions and share them with the EWB in case our solutions are logical or not. So here in this point, I just want to move to Shihab to explain his present. So over to you, Shihab.
Is it clear? As Hashim mentioned, there were many difficulties that we face. But in collaboration with the UNDP and Engineers Without Borders, we were able to overcome all these difficulties. And also we gained sufficient experience and confidence. And the way of our thinking has been changed as engineers. All these encourage us to participate in YLB program at regional competitions. Actually, we participated with the ventilator, mass machine, and smart disinfection tunnel. And we were the winner of this program at regional competitions. Actually, we don't stop at this point. Nowadays, we are developing solar TikTok, and we are thinking or working with other innovations. I will let Hashim to talk about them. Thanks.
So what's next? What will we do? When we completed work on these innovations, we moved to the training phase of MSMEs. We were not limited to a specific place or area in the training. The training was in the north, from the north to the south of Yemen. There is no stopping us. We are now in the process of building a machine to make plates made of eco-friendly leaves instead of plastic plates. Also making edible spoons, mold, and solar tuk-tuk. And here, Engineer Safwan and Muhajib will explain what our strategy for the next. Over to you, Safwan.
Okay, as Hashim has mentioned, that after we have worked in innovations that specialized in fighting COVID-19 pandemic spread inside the country, we moved to another innovations that can be environmentally friendly and decrease the pollution and global warming. We have developed many innovations to produce products that are friendly, environmentally friendly, and consumed daily. If it is made from plastic or other materials, it will be affected to the environment. But we cared and concentrated about solutions that are caring about environment. Like Hashim mentioned, we made machines that produce edible and biodegradable spoons and plates, and we went further to water treatment and designing salt pans that can treat water and make the water available for many slice of people in Yemen. I'd like to give my most appreciation to Engineers Without Borders and Wisconsin-Madison University, who participated with us along with UNDP in Yemen to work along with each other to get these outputs come to the real world. Thanks, and I'll let Mahajib continue to talk about his innovations.
سيتم عمل سجل تجاري وشركة تجارية خاصة بنا لبيع كمامات للمراكز الصحية والأسواق التجارية. أيضا تلقينا طلبية من مكتب UNDP بصناعة كمامات قماشية لهم. حاليا يتم العمل على سولار توك توك سيتم إطلاقه قريبا في الأسواق المحلية إن شاء الله.
In the end, we want to say thank you so much, UNDP, for the hard working that you come with the Yemeni Mechatronics engineer, and we do not forget Wisconsin University and Engineer Without Borders. Thank you so much. Over.
Thank you, Hashem. Then we'll go to the last question for Arvind, and then we'll wrap up the initial round of the panelists and we go to the Q&A session. So Arvind, fantastic story, very successful collaboration across the borders in a very difficult environment. The question specifically to you would be, how do you see this model working in other sectors in Yemen, given all the difficulties that we collectively face in implementing programs and projects all over the country? Over to you.
Thank you. Okay, and well done again to all the support and collaboration that came through with Engineers Without Border, University of Wisconsin, and group of Yemeni engineers. But of course, the guidance came through Luca and Yuko as well, and the support from senior management from UNDP country office. Let's not forget that as well. But I think the innovation that came during the pandemic has given a trigger. Actually, you could hear from the engineers that they have started already building up on the lessons learned and innovations. So for example, we are now looking at the waste to energy. We are looking at water desalination. So this model has brought the importance in terms of power of innovation. Plus, I would also say that, in the protracted and fragile crisis like Yemen, the support from technical institutions and universities, I think, are much more needed, because that brings us to a science to explore that how the local resources can be utilized while meeting the global standards. I think this is what this collaboration has demonstrated. Irrespective of which part of the planet you are in, you can still provide that support. So I think the way we are looking forward is to tackle the environmental protection aspects, which is one of the key in Yemen, as well as climate security aspect. And I think this kind of a partnership will definitely bring more innovation, bring more adaptation, which will help actually to sustain the initiative, because the innovation, if they are local, they remain local, and if they are and they can think global, but they can make innovation local.
Fantastic, Arvind, and I'm especially excited about the prospect of having solar-powered tuk-tuks. I think it's going to be an amazing innovation in Yemen that will not only contribute to the environmental concerns or against environmental concerns, but I think also given the fuel crisis in Yemen, this would be a fantastic alternative. Now, with that, we close the first round of panelists and panel questions. I have here a question from Jamal that I'd like to share, and maybe Arvind, you can kick that off, and then we can see if other panelists like Hisham also want to come in, given the nature of the question. And the question reads as follows: How did the team deal with licensing in Yemen? So, I think the approval, the authorities, and so on and so forth. So I think, again, how did the team deal with the licensing, required licensing in Yemen? Over to you first, and then perhaps Hisham can also talk about it.
So my answer is in two parts. One is that the prototypes that we have developed, we have also presented it to the relevant authority. Plus, we have worked very closely with WHO in terms of looking at the overall standards. When it comes to licensing, I think we have been advised to register this under Ministry of Industry and Trade. So that is how we are dealing. And what Al Muhajab has said, that they would like to register as a social enterprise, and that can then take care of the licensing aspects of these prototypes. Because let's not also forget that these prototypes are meant for replication. They are meant for adjustment, suiting to the needs. And this is why the innovation was very important for us. And definitely we are looking for licensing aspects while working closely with the Ministry of Health and also the health sector in particular.
Hisham, I hope you got the question. You have any complementary thoughts on this? Over.
As Arvind and Hajib said, we are trying to start our company, our private company, to do business in this. Muhajib, if you're still here, you can hear at some points. Over to you, Muhajib.
كما ذكر الأستاذ أرمن، سيتم عمل سجل تجاري وشركة تجارية خاصة بنا. اتبعنا كافة المعايير والمقاييس الدولية وما نصحتنا به WHO وفقا للمعايير. سيتم البيع المباشر والتعامل مع المراكز الطبية والصحية والأسواق المحلية، تتوفر منتجاتنا وفقا لكفاءة وجودة عالية وبسعر مناسب أيضا كافة الأسواق المحلية.
Thank you very much. So going forward on the questions and answers, you can look at the chat box to see if any further questions have come in.
So I definitely see one question from Ali. Thank you, Ali. And I think this is very important and very good question. Definitely, this kind of a collaboration does bring to the next stage when we would like to think about sustainability aspects, and how do we engage the vocational institutions like Ministry of Tibet and others actually to train them on these sector. Because let me also tell you that this pandemic has also provided an opportunity, despite of all the impact that it has brought in, is an opportunity to improve, but also to go and see that and how this can help in generating incomes for many Yemenis who are looking for job opportunities.
Jess or Hashim or other panelists, you want to come in here as well on this question?
I really agree with Arvind, and I points here. So,
sorry, Hashim, you faded out a little bit. Could you just repeat the last 2-3 sentences? Thank you.
I'm sorry. I said I really agree with Arvind. What did he say? And I think he covered all points here, what was mentioned in the question. Thank you.
Thank you very much, Hisham. Jess, do you see any further possibilities for engaging with Yemen engineers, or is it something that you consider now, you know, of a closed project and you move on to something else? Over.
I think from Engineers Without Borders perspective, I mean, we really enjoyed working with the Yemeni engineers. And if there's opportunities for us to collaborate in the future, our team feels very strongly about building local capacity, especially as we saw in this pandemic, the supply chain for a lot of medical supplies just absolutely collapsed. So anything that we can do to support countries building their own local capacity and taking advantage of the expertise and resources that they have available, we'll continue to support if there's an opportunity for it.
Thank you very much, Jess. I have also a question for Luca. Luca, you know, Yemen is probably the mother of all crisis countries at the moment, right? So I'm sure it offered also some reflection on your part in terms of what is actually possible within the context of these kind of collaborations. Do you see this as something that is also replicable in other kind of, you know, heavy crisis countries? You can, well, you know it yourself the best, but you know that we have quite a few of similar circumstances. Over.
Thank you. Okay, thanks for the question. I think it is, but you know, it is complicated and challenging, and it requires, first and foremost, I think, leadership and vision from the UNDP country office and a strong engagement and the unfettered conviction that you can actually achieve this even in the worst or the most complex environment. We are ready to support any country office that want to engage in similar arrangements. And as it has been said, this is not something, this is particular case, you know, is about PPE production and other equipment made with local material, with local capacity, with even eco-friendly, as we have said, material, and using solutions that are feasible for that particular context. So I think it is replicable to other efforts in the same thematic, let's say, area of expertise, but also in other areas. For example, if it goes, you know, in the production of clean energy or other solutions that can be adopted, and connecting the expertise that can be provided by the EWB and the University of Wisconsin. And I repeat it once again, on a voluntary basis. It's very important to stress this. These colleagues have worked on a voluntary basis, you know, not taking any other financial compensation, etc., and adopt that in the particular context of the country office. But none of this is possible without the collaboration of the local UNDP office, because the local UNDP office has to make that connection with the local expertise, with the private sector, with the national authorities, and put all the pieces together for this model to be replicated. So very much again, to reiterate the thanks to you, Alcock, and your team for the excellent work done in this case. Over.
Thanks, Luca. Very interesting. Rebecca, I just want to go to you with a question as well. I hope you're ready. I think it's a bit twofold, actually. One, that I'm picking up on a question that I see in the chat box here. I mean, just asking you whether, as part of the university, you're looking also at the cost-benefit analysis of this work, right? I mean, is it actually worth doing it, or is it just too labor-intensive, too costly? So this may, and would that sort of jeopardize the replication elsewhere? So that's maybe something you could reflect on. And then also, perhaps, what do you see as the key ingredients that are necessary in order to do so? Over to you, Jess. I hope it's clear.
Sure. I think I can take the first part of this question. So just in terms of the cost benefit analysis and particularly from the university's point of view, we learned a tremendous amount from this partnership as well. We learned different ways to collaborate with multilateral organizations, to collaborate specifically with country offices. As much as we provided expertise to the Yemeni engineers, UNDP and EWB and all of us collectively kind of shared expertise and experience that was valuable on all fronts. So from that point of view, for a cost benefit analysis, the benefits far outweighed, the efforts put in, and particularly in light of COVID-19, a global crisis. We haven't seen something like this, in the last century. So when everybody is affected, I think more and more over this past year and a half, people from every corner of the globe have realized that, their neighbor's health is their own, and we all benefit from, coming out of this together. We aren't going to be on the other side of the pandemic until we're all on the other side of the pandemic. So, there was a huge incentive to helping out. And I think something at the university specifically, we have what's called the Wisconsin idea, which is basically the notion that, our work at the university should extend beyond the walls of our classrooms, and it should reach every person in the state of Wisconsin and beyond that in the United States and around the globe. So it's just part of our culture at the university to kind of have this ethic of service, and particularly with the expertise required in this context, we were able to do that. And I think it was a huge pleasure to both share that expertise and then learn from the engineers. Could you repeat the second part of the question? I think
you're already, or you answered it already, Rebecca. It's
great,
fine. Thanks a lot. Yeah. I just want to share a question that was received through Facebook. Looking at the nature of the question, perhaps Hisham and Arvind, you will be probably the best place to answer it. So I'll go to Arvind first, and then I'll ask Hashim to come in as well. And this is something about working with youth, right? Which is in Yemen very important, because the big majority of the population is under 35. As a matter of fact, it's a very young population. So in terms of, the conditions in which they are right now, in terms of the failing education system and the failing health system and so on and so forth, how can they contribute? So the question is, how can you sustain and build the spirit of Yemeni youth and motivate them to contribute further to the nation's recovery? Arvind, perhaps you can kick that off, since you're working on these subjects on a daily basis, and then maybe from Hashim, from a personal perspective, you could also reflect on that. So Arvind, over to you first, and then I'll give Hashim the floor.
Thank you. Okay, and I think it's a very good question. If you look at the demography of Yemen, you would find that there is a huge population of youth and as well as women, and leading many responses in Yemen. So I think when it comes to contribution to the crisis, and responding to the crisis basically by youth, I think they are the brand ambassador. And this particular, the initiative that was led by the group of engineers who are also youth, sends across a very strong message that, they have the talent, they have the skill and knowledge, and given their right forum and platform and support, probably they can turn things around actually. I mean, just to put things in perspective, that the kind of a small machine that they have developed, it is such a powerful machine that it can meet, if it scaled up to the demand of the PPE kit basically, and the mask, particularly what is needed. So I think, even within UNDP, our country strategy has focused to support youth in all our programming as well as in targeting, and to support and educate them and integrate them into responding to the crisis, including this pandemic.
Thanks, Arvind. Hashim, you're a very young and talented man. I mean, how do you feel about that? How do you see the role of youth in sort of the future of Yemen going forward. Over.
So we all know that the pandemic has a big effect to all people, especially young people in Yemen. But I believe that Yemeni people, especially the youth, if you give them the chance, they will make something you will not imagine. So only give them a shot, give them a chance. He will prove that he is able to do it. All life sites have been affected because of this pandemic. But I know Yemeni people will stand up and they will complete the route. Over.
Thank you very much, Hashim. Just a final question, perhaps, before we get into the slowly wrap up of the session. In terms of, this is a question to you, Hashim, again, I'm sorry, but I think people are very interested in what you're having to say, is how can other youth help you or join you in your efforts? Are you open to collaborating with other youths that are interested in having the talent to contribute to your work, or it's more related to the group you're working with right now? Over.
No, actually, we are open to all people who want to collaborate. So even when we, our team, when we were in the college, we were open to another field of engineer, with electrical, with mechanical engineer. So we are open and we do not have any problem to collaborate with anyone.
That is great. So I'm sure they can contact you one way or another, right? In terms of making that happen. And otherwise, we can certainly facilitate that as well. I'm just looking at the agenda here. And we slowly have to go into the wrap-up phase. So I'm just going to check if there's any final questions. I see a question here from Muhammad, who's asking about UNDP projects and the fact that they're, that they're not implemented or showing weaknesses in the Hadramaut governorate. I'm not sure if it's very relevant to today's discussion, but certainly this is something we will look into. The projects in Hadramaut are covered from the Aden office, and we're using a whole range of implementing partners to also have projects in Hadramaut. So thank you for your comment on that, and certainly we'll take that seriously and look into it. I'm just going to check quickly the Q&A box to see if there's anything else there. There was another question from Ibrahim, which is more or less already answered, I see here, which is asking how he can share his skills with you and the talented team. So thanks, Hisham, for already answering that question, right? So let me see if there's one more question. Yeah. One second. I don't see any other questions anymore. So Hashim, according to the program, we wanted to give you the floor to give some final reflections to all the friends and participants and colleagues online. So if you have any final words for us, then I'll wrap it up after and close this webinar.
So as I said before, in the end, we thank the UNDP and Wisconsin University and Engineers Without Borders, because if UNDP does not give us the chance, we will not be able to make people see us. So thank you so much, and it's over.
Thank you, Hashim, for that. And we also, on behalf of UNDP, but also from the perspective of the Engineers Without Borders and the University of Wisconsin, we really want to thank you and your colleagues and your friends for this collaboration. It's been amazing, and it really shows the resilience and the dignity of Yemenis to be able to, you know, still make something out of nothing, really. I'm 5 years in Yemen, and I've seen that all over the place. So congratulations with that. And it's definitely a project and a success that we are hugely proud of. And, you know, we really look forward to working with you and many more Yemenis in this field and see how we can make more progress. Local solutions are always better. And certainly during these times where life is so difficult in Yemen, I think this is really one of the ways forward for all of us. I'd like also to thank all the panelists from Luca, Arvind, Rebecca, Jess. You know, thank you for coming online and share with us your experiences. You have made a major contribution to, you know, the work of UNDP, but certainly also Yemenis such as Hashim and his team you know, to make that a success and make it an example for everybody else as well. And like I said, you know, we're hugely proud of this, and we really look forward to continuing also other innovations. And certainly, I want to ride one of these tuk-tuks when you have it ready as a prototype and see how that goes. But it's a very exciting item. So I also wanted to say thank you to the UNDP comms team for pulling this all together. It went very smooth, and for once the technology did not let us down. It worked very well. So thanks a lot for that as well. And then finally, also a big thank you to all the participants for coming online and showing interest in the project and in Yemen. We really appreciate that, and we hope to come back to you with yet another exciting project that we can share its experiences with all of you. So thanks, Luca, also for the support. We really appreciate that, and looking forward to the next time. Thank you all, and goodbye.